All right, we'll go ahead and get today's press call started. Today we have Lori Christenson, our Gallatin City County Health Officer. We have Kallie Kujawa, who is the Bozeman Health COVID-19 Incident Command Lead. And we also have Tracy Ellig, Vice President of University Communications for Montana State University. And I'll pass it over to Lori.
Thanks, Holly. Appreciate it. Thanks for joining us, everyone, today. I'll go ahead and start with our weekly surveillance reports. Okay, so here in figure 1, I'll turn your attention to the very end of this figure here. And over the past 7 days, so from 9/22 to 9/29, we have observed, as you can see here, a downward trend of the number of COVID-19 cases, based again on that 7-day average per 100,000, as well as a total number of cases per 100,000 in the last 7 days. So that's that CDC community transmission number or metric. So I will say at this point in time, we are cautiously optimistic that this trend will continue. And really a lot is going to depend on continued vigilance in our community. You've heard us say it before, and we'll continue to say it. It's really talking about practicing good hand hygiene, wearing a mask in indoor places, and continuing to vaccinate those that are eligible at this time, whether that be a first dose, a second dose, or a booster for those that are eligible. So again, cautiously optimistic. The other thing I just want to point out, we did see a spike when a lot of individuals kind of returned to that indoor setting. So we've really been enjoying some nice outdoor time. And so as more activities turn into indoor settings, it's hard to determine kind of what path we're on. But again, if we're continuing to stay vigilant as a community, hopefully this downward trend continues. Moving on to our figure 2, which is our 7-day average percent positivity. Again, we saw a decrease from 11, our 7-day rolling average of percent positive was 11.5%. And that was about a 9% decrease from the previous week. So again, we're trending in the right direction here. Median time from specimen collection to report to public health remains 1 day. And then we provided these new figures last week. So again, just to walk through, this is based on the MMWR week. So when we look at these bars here, the orange is indicative of those who are not vaccinated, and the blue is those who are fully vaccinated. And again, we continue to see some breakthrough cases, but again, a lot of our cases continue to be in those who are not fully vaccinated. Moving into the hospitalizations by vaccination status. Again, this is a new figure that we provided last week, and we're doing that again this week. Again, this is by MMWR week. And again, these light bars represent weekly hospitalization counts among fully vaccinated Gallatin County residents. And the orange bar represents those who are not fully vaccinated. And as you can see here, far more people are hospitalized for COVID-19 that have not received a full series of COVID-19 vaccine. First dose figures here, again, we continue to see a slight increase of the first dose, individuals seeking a first dose. And we saw probably more of a uptick in moving in the percentages among those fully vaccinated, likely because those who received their first dose a few weeks back have come back for their second dose. And I'll reiterate the importance of getting that full series. So not only your first dose, but also finishing up with that second dose if you are receiving one of the mRNA vaccines. So this is a good trend that we want to see. And right now we're still seeing about 60% of Gallatin County residents who are fully vaccinated. Our school data, again, is available here. And I'll go just to the last piece here, which is we continue to be in high transmission. Again, as I mentioned earlier, we are seeing a downward trend, but we're still in high transmission. So that means that we continue to be remain vigilant, as well as really wearing that mask when you're in indoor settings. It's going to be really important. And with that, I'm going to stop sharing my screen and turn it over to Kallie.
Great. Thank you so much, Lori. And thanks to everyone for joining us today. We currently have 17 COVID-19 positive patients hospitalized at Deaconess Hospital. We have one COVID-19 positive patient hospitalized at Big Sky Medical Center. Our critical care unit at Deaconess Hospital has 20 beds and is currently at 95% capacity. 7 of the 20 patients in the critical care unit are COVID-19 positive, with the remainder being here for other healthcare needs. Additionally, our medical unit is at 85% capacity and our surgical unit is at 83% capacity. While we are still having very high numbers of hospitalized COVID-19 patients, we continue to provide normal, or what's known as conventional, standards of care. I do want to remind the community of our additional visitor restrictions. We will no longer allow visitors unless they are necessary for patient care delivery or for emotional support. This week, in partnership with Gallatin City County Health Department, we've held booster vaccine clinics at Deaconess Hospital for Pfizer BioNTech vaccine recipients. We administered a total of 2,069 boosters so far, and that was as of 10 a.m. this morning. Very, very proud of our efforts there. That administration will continue over the next weeks, and individuals can sign up for an appointment on healthygallatin.org. We are also encouraging people at this time to get their flu shot. I know that there are questions about whether or not it's safe to get your flu shot and a COVID-19 vaccine at this time. And I'm happy to share that a recent clinical trial found no signs of danger in getting a flu shot and a second dose of COVID-19 vaccine at the same time. And these are really results that support the advice of our US health authorities, that it is safe to get them at the same time. I also want to remind folks that we do not turn anyone away who needs care. We are caring for all people, regardless of their vaccination status. We are not turning people away for any care based on their being vaccinated or unvaccinated. And I can say, speaking as a nurse myself, we would never do that. Please remember that everything you hear on the street is not always accurate. And Bozeman Health has been a trusted community healthcare provider for 110 years. And that is an honor we are grateful for every day. That's really all I have for today, but I'm absolutely happy to answer questions. Thanks again so much for your support.
Thanks, Kallie. Tracy, I miss you.
My name is Tracy Ellig. I'm the Vice President of Communications for Montana State University. Lori, can you give me a thumbs up? Can you hear me? Thanks. So Montana State University is also cautiously optimistic about the trends we're seeing. So we increased our mask requirement 2 weeks ago, that it was all indoor spaces. So we did that on September 17th. On that Friday, during this call, the number of MSU affiliated cases was 64. So we've had 2 weeks since that additional mask requirement has been in place, and we're cautiously optimistic because the number of MSU-affiliated cases has dropped to 45. That seems like an encouraging trend. The university will continue to have a mask requirement for all its indoor spaces until further notice. I just want to re-emphasize that is that the university's mask requirement will remain in place until further notice. We continue to emphasize vaccinations, and we're also very grateful for all of the assistance and data that we have gotten from our health partners in the county. That's all I have. Thank you.
Thank you. I just want one quick go back to something Kallie had mentioned with regards to our joint efforts to provide those booster doses. We are just updating our website now. So by the end of the day, we'll have links for next clinics, next week's clinics available. I just wanted to just add that little bit of clarification, but those links to sign up will be on the Healthy Gallatin website. We're just finalizing a few details for next week. Thank you. Okay, I guess at this point in time, we are happy to open it up for any questions that any of you may have.
I have none for now, just to let you know.
I always learned that a good facilitator gives a good pause. So I just want to provide that space for folks.
I figured. I just want to let you know from my part here at KBZK, we're good for now.
Thanks, Cody. All right. I am seeing none. Oh, Freddie, did you have a question? Or Olivia, here we go.
Hi, yeah, I just had a question, not necessarily related to what you were talking about today, but I've just noticed, a high number of cases in the K through 12 schools. I'm wondering what data might be available just on, whether or not kids in that age group are getting sicker and perhaps having more hospitalizations during Delta. I guess, what are you seeing on that front?
Kallie, do you have those data available for hospitalizations?
For pediatric hospitalizations, we have had pediatric hospitalizations. I don't believe we've seen an increasing trend in pediatric hospitalizations, but as far as exact counts go, I don't have that information today, but we can get that. We are closely monitoring how many clinic visits our pediatric patients are having for all respiratory related illnesses. And we are monitoring how many are COVID positive of the patients that we see at Deaconess and Big Sky Medical Center. But I don't have all of that right here today. But if you reach out to Lauren Brendel, we can work to provide some of that information.
Okay, yep, I'll follow up.
Great.
Hey, this is Holly Michaels with Lee Newspapers. I had a question too, not specifically related to anything you're talking about, but I'm trying to get an idea of COVID and how it's affecting pregnant women and newborns in Montana. And I'm wondering if there's any sort of tracking that Bozeman Health does with that. And what I'm hearing is it's kind of difficult because if it's a woman pregnant but not delivering, it sounds like they're not really coming into the hospital and seeing their OBs, they're staying home. But I'm wondering if there's any sort of tracking that the hospital is doing, looking at baby women when they're delivering, or if during certain stages of their pregnancy, they can track COVID and outcomes, and just trying to get an idea of what data might be out there.
Sure, that's a great question, Holly. We test all of our patients who come into the hospital, and that would include our laboring mothers. So we do test them, and on a daily basis, we have a census that we look at to see how many patients are COVID positive in the hospital. And we do have COVID positive patients in our labor and delivery area, as well as our postpartum area. We are, we test them before they come in. Oftentimes they're asymptomatic, but we do find some of those that are symptomatic. And we just take, you know, obviously many extra precautions during the labor stages, as well as caring for them afterwards, for both the newborn and for the mother. But as far as counts, I don't have those right off the top of my head, but I'm sure we could provide some information on how many patients we're seeing in our labor and delivery area that are COVID positive. Now, remember, sometimes that's an incidental finding versus a symptomatic finding, and we won't decipher between the two of those. And, you know, that's just because we test all of them when they come in.
Okay, thank you. One thing that made me wonder, are there different sorts of protocols or different places for women who do test positive when they come in to deliver? Like, are they on the COVID? Or I guess I'm just wondering how that's handled to keep, you know, the people around them safe.
Yeah, so we have for all patients different procedures to follow for aerosol generating procedures. And when a woman is laboring, she's aerosolizing while she's breathing. And so we do consider that an aerosol generating procedure. And so we put those patients in airborne precautions. So the staff have to wear an airborne level of personal protective equipment, and we have to make sure that the space that that patient is in sucks all of the air out of there and to the outside instead of letting it go into the rest of the building. So that's something that we follow and include in that room, which is negative pressure. Now, something also that we've had to set up a workflow for is for those people who require the use of our operating rooms and are COVID positive. When we intubate someone for a surgery, that is an aerosol generating procedure. And so we have to have the room set up differently, and the staff use different types of PPE when caring for someone who's a known positive. So we have different workflows. However, they are all receiving the same standard of care. They just may receive care in a more appropriate location, and the staff may be wearing different levels of personal protective equipment for the patients who are positive. And so with our labor patients, at times they do need to convert and use our OR. So we have workflows in place for accommodating any situation we should encounter with a COVID positive laboring patient.
Thank you.
Mm-hmm.
Hi, this is Freddie Monadas with Montana Public Radio. I was just wondering if the county has been able to keep up with COVID-19 testing demands there.
Sure, yeah. So we have been able to keep up with testing demands recently. We stood up a Belgrade drive-through site to meet the increased demand. And we have created some workflows through our urgent care settings to increase testing access as well. And we continue to have our Lot H on site at Deaconess campus as a way to get tested as well. And then in our Big Sky location, individuals can present and receive a swab through our medical center up there as well. So at this point in time, from a specimen collection standpoint, we have had to hire in a lot of extra staff to help us with specimen collection, as well as registering all of those tests into the medical records. So we have had to hire and contract a lot of staff to help us with that. As far as processing the specimens in our lab, we continue to monitor our turnaround times and from a PCR standpoint are we're comfortable with what our turnaround times are currently, to allow for contact tracing, and to allow for people to receive their results. The last I checked, it was roughly an average of a 12-hour turnaround time for a PCR test. So we are meeting, we are able to offer testing, and we're working to find that balance of how do we increase additional access while being able to support an entire system of other healthcare needs as well. So it's an interesting balance that we're trying to find at this point in time. But we so far feel that an outcome measure that we're monitoring is our turnaround times, and we're satisfied with that currently.
Thank you.
Mm-hmm.
Any other questions out there? Okay. Well, seeing none, thank you again to Tracy and Kallie for joining us today. And for all of you as media partners, it's really important that you help us provide this information to our community. And we appreciate all that you do, and we will see you again next week. With that, have a good rest of your day.
Thank you, Lori, Kallie, all you guys. Appreciate it.
Thank you. Take care.
Thank you.